Before abortion was legalized, nearly 50% of all maternal deaths in Albania were from illegal and unsafe abortions. But in 1995, abortion law was approved, and based on this law, abortion on request of the woman may be performed up to the 12th week of the pregnancy for socioeconomic reasons, and up to the 22nd week of pregnancy for other health reasons of woman or fetus. But after the abortion law was approved, the number of induced abortions was raised, and the Institute of Statistics was in charge to collect all the information regarding abortions in Albania. But not all the districts report to the Institute of Statistics the number of abortions they performed. So, with an order from the Ministry of Health, since May 2007, the Institute of Public Health has started to collect all the information regarding abortion and to establish the National Abortion Surveillance System. The main document for reporting abortions is the abortion form. Our main objective in this report was to monitor the trends of abortion rates in Albania over the period 2010-2015 in order to improve the family planning programs. And specific objectives were three: to describe trends of abortion rate and ratio in Albania over this period of time, to describe and compare the frequency of spontaneous abortion and induced abortions, and to describe and compare the frequency of abortion by different characteristics of women. The report is based in the National Abortion Surveillance System. The abortion form contains information regarding different variables, for example, woman age, residence, marital status, educational level, employment and insurance status of the woman, type of abortion, if it is a spontaneous or induced abortion, gestational age, pregnancy history, previous live births, spontaneous or induced abortions that the woman had, method the doctor has used for performing abortions, and ICD-9 code. In the report are presented three measures of abortion: total number of abortions, abortion rate, which is the number of abortion per 1,000 women of reproductive age, and abortion ratio, which is the number of abortion per 1,000 live births. Here it is presented the flow of information of the abortion form. The abortion form is filled by the doctor who performs abortion in the public or private hospital, and then these completed forms are sent to the hospital statistical office. In every district we have a key person, usually is the reproductive health inspectors. He go in the hospital and take all this information regarding abortion. So he take all the abortion forms that are completed by the doctors in the maternity wards. But also he check the register of abortion to see the number of abortions that are performed in the hospitals. And then all these abortion forms are sent to the National Institute of Public Health. Our institute is responsible for collecting all this information at national level, and then to analyze the data regarding abortions and compile the reports and send these reports to the Ministry of Health and the Institute of Statistics. In the graph is represented three measures of abortion, so total number of abortion for the whole period, abortion rate and ratio. Regarding the number, the highest figure is in 2011, and after that we observe a linear decline over years. Abortion ratio decreased with 16.7% compared to 2010, and this decrease was significant, and abortion rate also decreased with 23.2%, and the decrease was significant. In the map is presented the indicator abortion ratio, which is abortions per 1,000 live births by regions in Albania for the whole period. And we can see that the most affected regions are 4 regions which have the highest number of abortions. They are with a red color. Regarding the two types of abortions, spontaneous and induced, we can see that there is an increasingly higher trend of spontaneous abortions compared to induced abortions. From 2010 to 2015, the increase with 26%, sorry. The abortion rate by age groups in Albania for the period, the women aged 25 to 34 years account for the majority of abortions, and abortions are less frequent among adolescents and older women more than 40 years old. Regarding women's residence, the abortion rate, we can see from the graph that in 2010, the abortion rate was higher in urban areas, 13.8, but in 2015, the trend reversed, and we see that the rates now are higher in rural areas, so it's 9.6 the abortion rate in rural areas. For the year 2015, we can say that more than 92% of women obtaining abortions are reported as married. 45% of abortions are from women with low level of education, less than 8 years, and women with university account for 16% of abortions. 84% of women who had abortions are unemployed and uninsured, and 82% of abortions are performed at 12 weeks or fewer of pregnancy, and more than 85% of abortions are by women who had neither previous induced nor a spontaneous abortion. During the period 2010 and 2015, we have seen a linear decline in abortion number, but still we think that abortion is underreported in Albania because we have the 70% of reporting with the abortion form. So the number in the register is higher than the number that is reported with the completed abortion forms. And we think that abortion still continues to be underreported in Albania. And from 2013, we are missing the information regarding abortions performed in private sector. So for the period 2010 and 2015, we can conclude that there is a linear decline in abortion number, rate, and ratios, following the decline trend of live births in Albania. There is an increasingly higher trend of spontaneous abortion compared to induced abortions. One of the reasons may be to avoid the official payment for induced abortion. In Albania, if a woman wants to perform an induced abortion, in the maternity wards they have to pay. But a spontaneous abortion is considered an emergency, and the woman doesn't need to pay for a spontaneous abortion. So from the conversation with the doctors, often it is told that to avoid this payment, the doctor registers a spontaneous abortion as an induced abortion as a spontaneous one. So for that reason, we think that the number of induced abortions in Albania are underreported. And the third point, that we see a growing trend of abortions in rural areas. And possibly one reason is that women living in urban areas have a high level of awareness about abortion. They are more educated and they use more contraceptive methods than women living in rural areas. This can be one reason that the number in rural areas is higher now. As recommendations, we can say that we need to improve the quality of reporting by continuously training the staff responsible for abortion, especially in the public health directories in the districts, the focal points, persons on data collection, data entry, reporting, and monitoring process. And we need to focus more on programs to reduce the unmet need for modern contraception as an effective way to prevent unwanted pregnancies and abortion, especially for specific groups, like less educated women or women living in rural areas. And finally, I want to thank all the contributors in this report, all the specialists that are in the public health directories and in the Institute of Public Health, national focal points and supervisors. Thank to Dr. Nicoleta for all the suggestions and guidance given in writing the report. And thank you to MediPIET team for giving us this opportunity to present our work in the conference. Thank you. Faliminterit in Albania.
Thank you very much, Alba, for this very interesting and on very professional way presented paper. Now I am opening the floor for the audience to raise a question or give a comment. Yes, please. We're just waiting for microphone. Yes, thank you.
Thank you for your nice presentation. I'm Dr. Hana, coordinator of National Surveillance Program in Egypt. I want to ask you about what is the risk factors of spontaneous abortion, especially in rural area, because you mentioned that there is increasing trend in rural area. Thank you.
We have calculated the data mainly based in abortion form. The abortion forms contains information regarding abortion, how it is performed, and some information for the woman, but not about the risk factors. So we have previous number of abortions that woman has performed, for example, if it is a spontaneous or induced abortions, but we don't have in the abortion form the risk factors. So we think that from the conversations with the doctors that one of the reasons maybe is to avoid the payment in the maternity wards for the induced abortions. But this needs further study to investigate why this number is higher, or maybe the spontaneous abortions are reported better than the induced abortions. So we are missing some information from induced abortions in Albania.
Satisfied with the answer? You're satisfied with the answer? Yes. Okay. And anybody else from the audience who would like to raise the question? Yes.
Thank you for your attractive presentation. Now, I'm Nana Mebonia from Georgia, and I'm interested. You underlined that high proportion of women who make abortions are from the uninsured women, and I am interested in proportion of insured and uninsured and insured population in your country.
I said that there is a higher proportion of women performing abortion that are uninsured and unemployed. So maybe there is a relation between insurement and the employment status of the woman. So there is more than 84% of women that are unemployed and uninsured. They are that have done abortions. More of them are unemployed and uninsured. In the whole population, you mean?
Yes, in whole population is uninsured number, proportion of uninsured population. For example, maybe if you have high proportion of uninsured population, because of this you have this abortion among those.
Yeah.
And if
I cannot give you exact number. Okay. Maybe I will check the exact number of unemployed and uninsured women. So, but I know that the unemployment rate in Albania is high.
Anybody else from the audience? Yes, please.
He is my supervisor.
Thank you, Alba, for your interesting presentation. My question is, you said that the rate of abortion has declined through the years in Albania, yes? So you associate this with the higher use of contraception or family planning services, or other reasons for this decline in abortion trends? Thank you.
The main reason, we have seen that the number of abortions during this period of time has declined. But also we have seen that the number of live births in Albania are decreasing. So maybe this trend of abortions follows the same trend of live births in Albania. So we think that abortions are decreasing as the live births are decreasing also. But we think that the number is higher than the one that is reported in the Institute of Public Health, because we have a contraceptive prevalence rate that is low in Albania, so this number could be higher.
Okay, thank you.
Anybody else to raise the question? Actually, the issue is very interesting, especially when we are facing quite a neighboring countries to Albania who are really trying to introduce no abortion, no eligibility of abortion for female. And I really think that going further, having the surveillance system of abortions is a very big step ahead. And also maybe related to the raised questions of a higher number of abortions in a rural area, the additional data related to, you already mentioned that these are mainly among the low educated female. It is also interested how many children do they have already when they decide to do the abortion, and maybe some about their social economic status, which can probably also be one of the further factors who will influence actually the decision to make the abortion. If there is any other question from the audience, yes, please.
Thank you. Just simple question here regarding the form, the abortion form. Do you mention the form, the contraceptives, and the type of contraceptives that's taken in both? And do you find any differences between the rural area and the urban areas regarding the type of contraceptives, and if it is affecting the abortion rates in the last years? Yeah. Thank you.
I mentioned that all the fields that were in the abortion form, but we don't have the type of contraceptive the woman that performs abortion has used. But in the Institute of Public Health, we have a program about contraceptive use of women in rural and urban areas. So maybe we can collaborate together with that program to make a study regarding how many women that performs abortion, how many of them have used contraceptive methods, because we know that the contraceptive prevalence rate in Albania is very low, modern contraceptive prevalence rate. So, but in the abortion form, we don't have information regarding contraceptive the women have used.
Okay, thank you very much. If there is no any additional question, we would like to thank to Alba. Alba, you were really brilliant. Thank you very much.
Thank you.
And actually, we can go to the next presenter. Thank you very much.
Thank you.